Hi, everyone. It's okay. Hi, everyone. My name is Lauren Walmsley, and I'm the Director of Outreach and Recruitment, and I am with the West Virginia University School of Medicine, and I will let my admissions dean introduce herself, and then the recruitment specialist introduce herself.
Hi, my name's Linda Neild. I'm the admissions dean starting my 9th cycle at WVU, but I've been there since 1990 for 33 years. And I am also a pediatrician. So thanks so much for joining us and listening to WVU School of Medicine, our presentation.
Hi, everyone. My name is Mackenzie Berlin. I'm a medical school recruitment specialist here at the W School of Medicine. Currently just starting on my first round of everything. And but I have been with the School of Medicine for almost 2 years. I worked in the student services side for about 1.5 years, and now I'm just transitioning over to the admissions side.
Yeah. Good. Thank you so much for joining us. So between the three of us, hopefully we can answer any questions that you have. So before we get started, we always have to disclose that all information is from the viewpoint of the WVU School of Medicine admissions team. So what we have to say may not be reflective of any other medical school and is based off of our particular viewpoint. So who we are. So we like to give a little bit more of a background about where our office is situated and how we kind of fit into the School of Medicine. So we are part of the WVU School of Medicine in the Department of Medical Education in the Division of Undergraduate Medical Education. That's where the Office of Admissions is located, and we oversee the Committee on Admissions. So while we do not vote, because the Committee on Admissions has the final say on who is accepted in a medical school, we oversee the Committee on Admissions by training them, training them on what to look for in incoming medical students. The Committee on Admissions is responsible for all applicant and policy decisions, and then they inform us of what those decisions are. Dr. Neal, do you have anything else to add to that?
And it is a committee decision. That's a Association of American Medical Colleges serious regulation that has to happen. So, but it falls under our office's oversight. Thank you.
So we're one school with 3 campuses. So our main campus is located in Morgantown, West Virginia. That's where all medical students will start their first 2 years. And then the 3rd year, 60 students will stay on the Morgantown campus. 40 students will go to the Charleston campus, which is our state capital. 12 students will go to our Eastern campus, which is in Martinsburg, West Virginia, actually not too far from where you all are right now. How that's decided is once you've interviewed for our medical school, you actually rank your campus preferences, 1st, 2nd, 3rd, based off of when you are accepted is really where you'll get placed. So early decision applicants actually get their first choice to campus. So if you apply early decision, you're guaranteed your first choice. But from then it's rolling admission. So campus choices are decided based off of when you're accepted. So some quick facts. We've actually been around for quite a while, since 1903. We have a relatively small medical class size of 112. Our acceptance rate is 3%. We don't add this statistic to, intimidate, but just to be very transparent that it is a very competitive process. We sponsor more than 80 residencies and fellowships in West Virginia. We're very proud of this fact. There's a lot of opportunity to learn from a variety of specialties when you're in medical school and continue your training in West Virginia post-graduation. We've consistently match in more than 20 residencies in more than 20 states each year. We're also a R1 research institute and have been, I've lost track of time, but I feel like it's been at least 5 to 6 years at this point we've maintained that designation. This is important. We were very proud of this designation, as only 130 roughly universities and colleges get this designation in the US. And we also have roughly 51 student organizations. For a small medical school of 112 per class, 51 student organizations give students a lot of opportunity for interest groups, to get involved in service organizations. We have organizations everywhere from a runners club, soccer club, to something called Project Reach, where students actually go out into the state of West Virginia and provide health education opportunities. We also have something called Mushroom, where our students work with a homeless population. by providing like basic healthcare checks. We have a free clinic that our students volunteer at, and that's also an organization. Dr. Neal, is there one that if you comes to your mind that you would like to mention?
Yeah, I was just going to say that Lauren and I even are the faculty advisors for a medical student organization called Med Coach, and those students help us with events like this. And that's something how you could give back too as a student, that someone was once in your shoes now, that
Yeah.
you can share your wisdom with what you've learned going through the process and how you made it to medical school.
Yeah. So we are a state school. That being said, we give preference to West Virginia residents and applicants with strong ties and those who meet our mission. But even as a state school, I think on average, each class is made up of anywhere from 40 to 50% of out-of-state students. We're a very out-of-state friendly in-state school. And that's specifically, we don't have a very large in-state population. So especially surrounding states, we give a lot of preference to as well. But from there, like I said, we give students with strong ties or applicants with strong ties and those who meet our mission, which we'll discuss here in a minute. We also give high priority to pathway students. And then of course, early decision applicants get high priority no matter what state of residence. You do not have to be a West Virginia resident to apply for our early decision program. And I would say each year we have at least a handful of out-of-state students who go the early decision route. So we're going to briefly talk about some of the programs and tracks that we have at WVU School of Medicine. And I'm going to let Dr. Neal start us off with our early decision program.
Yeah, so it's something for you to consider because it comes with a scholarship. When you apply early decision, you can only apply to one school. And so if you apply to us early decision, you cannot apply to another school until you get our decision. But when you apply early decision, AMCAS will expedite your verification, and then we're sent your application, and then we have to guarantee that you get a September interview of the year you apply, and we have to let you know by October 1st. That's one of the regulations. And you get your guaranteed campus choice, and you get a $30,000 scholarship that is that you will be split over the number of years that you're in medical school. To apply for early decision, you have to check early decision on the AMCAS application type, but you have to get it has an earlier deadline of August 1st, excuse me, each year, and you have to have a 3.6 BCPM GPA, which can be from 30 hours, ideally, of grad or post-bac or undergrad BCPM GPA, and a minimum of a 506 in the MCAT, ideally all subsections 125 or above.
Yes. I also like to point out that the statistic for early decision is very good. Like I said, we do you have like these like strict cutoffs, like you have to have a 3.6 science and a 506 MCAT score. But earlier I mentioned that our overall acceptance rate is 3%. Since I've been at WVU School of Medicine, the early decision acceptance rate, if offered an interview through early decision, has been roughly 90% or higher. So it's not a guaranteed acceptance by no means, but if students meet these requirements and have great experiences and are offered an interview, they tend to be pretty successful through the early decision program.
Especially if successful interview and coming across as being very committed to WVU.
Yes. So we also, within the last few years, have started our accelerated MD program called MATTER, where medical students can complete their MD degree in 3 years. We love an acronym, especially if we could throw Mountaineer or West Virginia in it. So it's Mountaineer Accelerated Track to Enter Residency. Currently, how this works is medical students can apply for this at the beginning of their second year of medical school. So it's not actually something, there are some programs where you have to commit to a specialty before you start medical school. This you actually apply for at the beginning of your second year. So you get, your entire first year, and then during the summer before your second year of medical school, you can take some externships to, thoroughly maybe explore some of these fields before you would consider applying. But if accepted into, like, let's say right now, emergency medicine, you would be guaranteed an emergency medicine residency at WVU Medicine, and you would graduate in 3 years. So you can see the residencies that we currently have listed. We hope to continue to add to that list in the near future. We are seeing would you say not, Mackenzie, an increase of students participating in Matter? Yeah, and this is not something that, you know, if a student gets a Matter track spot and then decides for at the last minute, like, oh, I don't know that I can commit to this, there is an option to then go back to the 4-year medical school plan. That's obviously not like, you know, something that these Matter residencies want, but it doesn't like firmly commit you to forever being in this Matter track. Dr. Neal, do you have anything to add?
Yeah, and the one of the great things about it is it is for someone who maybe comes into school having a good sense of what they want to do, and then through our required clinical experiences during your first year of medical school, you do a lot of shadowing of a specific field if you want to, as opposed to doing a variety, and you're convinced that's what you want to do. Then your 4th year of medical school, instead of you paying tuition, you're now getting paid to be an intern, and you will have already graduated from med school. So it is very attractive and something to think about. And that's what all students in their first year are thinking about, I'm sure, in the back of their head. And then when it comes first semester of second year, that's when they have to decide, are they going to apply for one of these programs?
We also have 3 specialty tracks that I think make our school pretty unique. We have one in rural medicine, culinary and lifestyle medicine, and global health. So how this works is for the rural track and culinary and lifestyle medicine track, you actually apply for these after accepted, but before you start medical school. So in the rural track program, you would start a month prior to medical school shadowing a rural physician. And it doesn't actually have to be in primary care. I know one of our current family medicine attendees that was one of my students, he actually did a rural surgery rotation a month prior to medical school. And then this just gives you more opportunities for rural health experiences throughout your 4 years. It does not commit you to pursuing a career in rural medicine, but I think it provides a lot of opportunity to explore that side of medicine. Culinary and lifestyle medicine track is very unique. This program you apply for once again before medical school starts. You actually get opportunity to take cooking classes, work with exercise scientists, nutritionists, learn more about the preventative side of like diet and exercise and how to treat and prevent illnesses in medicine. Dr. Neal, do you have anything to add to that one?
These are 3 unique tracks that certainly all 3 of them you're not going to find at another school. Some may have versions of it, but to have all 3 of them, and some students do end up doing 2 of the 3 tracks also.
Yeah, and the global health track, real quick, you actually apply for it during your first year of medical school, and you get the opportunity to take a tropical medicine course between the first and second year summer, and then your 4th year, you're eligible to do up to 2 months of global health rotations. Every student can actually do a month of global health rotations, but through this program, you can do up to 2 months. Very, very unique programs, and students really enjoy these options. I'm going to let Dr. Neal talk about this because she's actually the co-director of the Pediatric Residency Scholars Program.
So we have 3 Rural Scholars Program, which is different from the rural track. The Rural Scholars Program is something that you would apply for in your 3rd year of medical school. And let's say after you realize, hey, I want to do one of these 3 specialties, let me see if I want to do the Rural Scholar Program. It doesn't commit you to a life of rural medicine. You're going to learn skills as a rural scholar that you can take with you no matter where you practice. And you also get the luxury of, during your 4th year of medical school, you get a $10,000 stipend off of your 4th year tuition, but you also work a month with the co-directors of, for pediatrics, it's Dr. Emily Neese and I are the ones who are the co-directors, and we work with our research specialists in the Department of Pediatrics, and you come up with your own research project for that you're going to carry through or start in your 4th year of medical school and carry it through your residency program. And you're guaranteed a position in our residency program, so you don't have to go through the match and just the psychological relief, I guess you could say, of knowing where you're going to match is another benefit too. We have savings estimated there. You can see that large number. You can look at the AAMC website or where ERIS comes out of for the electronic residency application service. depending on how many residencies you apply to, and if residency interviews, many of them are going back in person, you can imagine the cost to travel to get to those residency interviews and accommodations and so forth. But if you do one of these scholar programs and already know where you're doing your residency, you say you have all the savings and you actually have more time for more electives instead of using it to travel. So a lot of benefits there if you were to decide to do a scholar program at our institution.
So STEPS is something we're very proud of. It is our simulation center here at our medical school located in Morgantown, West Virginia. In 2019, we actually received full accreditation. At the time, we joined less than 3% of centers worldwide to have this full accreditation. In this picture, you can see one of our second year med students. She's one of my models. She's actually on the left side. We actually, in our fourth year, offer a 2-week robotic surgery elective. And our student right here is working on the Da Vinci trainer. So during that 2 weeks, you get to spend, I can't remember how many hours on the Da Vinci trainer, and then you get to simulate operating using the actual Da Vinci robot that's in our simulation lab. That is not a real person. I just want to point that out. That is one of our high-tech mannequins that the Da Vinci robot is operating on. But I think our students get an average of 85 visits, planned visits, and then there's sections of the simulation lab that are open for students to use. If there's nobody scheduled in those areas, their swipe access allows them in areas where they can utilize ultrasound and get more time into the clinical exam suites so they can practice for things like their OSCEs and their clinical practice exams. We also actually have little small ultrasound units that our medical students can check out as well through the simulation lab. They do research in the simulation lab. They actually have their own IRB, which we're very proud of. They do a wonderful job, and I truly feel like students leave medical school feeling comfortable because they have had so many practice hours in the sim lab.
And this is the one that's in Morgantown, and there's a brand new one also on the Charleston campus. And the Eastern campus also has their simulation center. Just Charleston is the newest. And we haven't seen it yet, but I've heard just phenomenal kudos about it. So
this is a nice overview of our hospital. We call it the medical mile. Since I've started in the last 10 years, we've added 2 new towers, the Heart and Vascular Institute and our brand new Children's Hospital, which just opened in September of 2022. So starting out on the one end, you can see it looks kind of like a ship. That's how I like to describe it. That's our Rockefeller Neuroscience Institute, which we'll talk more about here in a minute. Then that goes into our Eye Institute, into our Physician Office Center. The middle part, you can see at the top, it says J.W. Ruby Memorial Hospital. That's where our level 1 trauma center is located, our emergency room. It's our main hospital. Behind that, you can see that tan building. That's actually where we're at right now. That's our health science center where the medical school is located. That actually attaches to the hospital via tunnel. I always joke with our medical students that you could easily zombie walk to and from, class through the hospital to your apartment, and back through, or take the tunnel when the weather gets bad. And that goes into our Heart and Vascular Institute. We do heart transplants at WVU Medicine. That's relatively new since 2019, and that Heart and Vascular Institute will then go to, you can see our more colorful hospital building. That's our brand new pediatrics hospital, which is beautiful. We're very, very excited to be able to offer a brand new children's hospital to the state of West Virginia. And Dr. Neal, as a pediatrician, is there anything you want to add?
yeah, I mean, certainly was so thrilled by the freestanding children's hospital, and it's actually quite large. It goes way back. It really, when you take a tour of it, it's just phenomenal. So the other thing I want to point out, as Lauren already mentioned it, that this is all in a row. It's very, very unusual to have all of this much medical complex all within walking distance, and relatively very, very safe area of the country to train and raise a family and so forth. And there's a good bit of housing that surrounds within walking distance of this entire complex.
Areas
So-
that you cannot see that are also on this campus is our Cancer Institute and our Psychiatric Hospital, which is actually right behind, I think, the Children's Hospital.
Yes,
That's
that's exactly where it is. Yes.
Yeah, it is really nice that a student can have all these experiences on
Yeah.
one campus.
Yes, and where, like us looking, where we're looking out of right now, we would be standing in the football stadium, right,
Yeah.
Lauren? Basically, the football stadium is where we are, and across the parking lot, you can see that whole complex. So, and
Exactly.
sometimes the football players will stand in the parking lot and wave to the kids who can look out the window.
Yeah,
That's happened a few times. It's sweet.
it's very sweet. So this is just an overview. We're not going to go through each of these, but it's a good snapshot of just some of the trainee programs, the graduate medical education programs that we offer through WVU Medicine, specialties and subspecialties and fellowships. Since I've been here, this list has continued to grow, even in the last few years. I think at one point we were 50 plus, and now we're over 80 plus. Training program. So even if you did not stay here for residency, you can imagine as a medical student having access to doctors who practice in these specialties is only a great experience for medical students. We already mentioned our brand new children's hospital that we're very proud of. And then this is something that I really wanted to mention. At the WVU Rockefeller Neuroscience Institute, if you have any interest in neuroscience, specifically, they are doing some groundbreaking research in several different areas. One being deep brain stimulation for addiction. So you can look, I honestly would just recommend going to their website and looking through the different news articles. Another one that they've done is we were the first clinical trial for use of MRI and ultrasound for Alzheimer's treatment. I don't think I have the picture of that one right on this one, but that's also an amazing project that is going on. You can see the one on the bottom. Lots of research using ultrasound and MRI guided and focused ultrasound to treat things like addiction, Alzheimer's, tremors, and Parkinson's disease, chronic pain. We also have had some interesting research with human performance in the military. So something we're very proud of, and the RNI is definitely making a name for themselves in the world. Anything else you want to add to that, Dr. Nate?
I would say you can just see it's national news. It's not just local reporting where it was,
Yeah, our Heart and Vascular Institute is also really doing some groundbreaking research, clinical trials. You can go onto their website. Actually, I was just showing one of my pre-meds today, all the different clinical trials that we are currently a part of at the HVI at WVU Medicine. Like I already mentioned, we are a Transplant Alliance center for both heart and kidney. And that has been since 2019. So that's something West Virginia desperately needed. And if transplant medicine is something you're interested in, of course, something that students can get experience, even possibly shadowing during medical school. So steps to applying. This is where we're going to talk a little bit more about our admissions process. The first step is to know the admissions timeline. We already talked about early decision a little bit, but just to point out again, the deadline is August 1st. This differs from regular decision. We actually will accept an MCAT date, depending on what year it is, for the next cycle, for this upcoming 2025 cycle. The last MCAT date is July 26th, so that date changes a little bit, but as far as like when AMCAS opens, it's all the same as regular decision. There is a deadline for the MCAT for early decision. August 1st is the deadline for the application. August 31st is the deadline for the secondary application. And then we guarantee that you will be interviewed in September. And then we have to let you know by October 1st. So oftentimes I was saying that if you interview on a Monday, our committee meets every Tuesday. Applicants typically will know that same week on a Wednesday, what their status is for early decision. So that's definitely one of the pros for early decision, is how quickly you'll be notified of your status and what you're going to do next year. Regular decision, application opens still at the same timeline. This is this past timeline. Interviews typically start in September and last all the way through February. We are not allowed to let you know until October 5th, 15th or after what the status is. So if you interviewed before that date, we can't let you know until after that date. The deadline is November 1st, but I would really strongly suggest that you would never wait until November 1st to submit your application. We have seen time and time again, things tragically happen, like AMCAS, sends back your application last minute because there's an error, and therefore, like, you weren't able to submit it on time, and just really sad situations like that. So never wait till November 1st. December 1st is our secondary application deadline, and like I said, we typically interview all the way through February for regular decision. So know the mission. Oftentimes people think the mission of WVU School of Medicine has something to do with rural health or rural medicine. And in fact, our mission is actually quite simple. It's to improve the health and well-being of everyone we serve. So our vision is a hopeful and healthy West Virginia, but most certainly we really just want to improve the health and well-being of everyone we serve, not just in West Virginia. Our strategic priorities are to educate, discover, and heal. And we lean on these a lot when we're talking to not only the Committee on Admissions, but to pre-med students who are working on their experiences for the medical school education application. So for example, educate. How would we look at that, or what would we look for in a medical school application that refers to education? So we're looking for tutoring, being a teaching assistant, leadership opportunities, being a mentor, a coach, anything where you're educating, leading, being an ambassador, that's a leadership position as well. Education, we think, is very important, a very important experience, having experience being a tutor, a teacher, an educator, because as a doctor, you will be educating your patient, working with your patient. I always steal this line from Dr. Neal, but she says the Latin word for doctor is ducere, which means to teach. Did I get that right?
That's correct. Docere or docere,
Yeah.
D-O-C-E-R-E, right? It means to teach. Excellent.
Yeah, I'm a good student. And then discover, we look for research opportunities. We don't have a certain amount that we look for, but we find that research is, and we believe as a Harlan Research Institute, that research is very important, and that you most certainly need to have the appreciation for research, just to like appreciate what it takes to, to advance the field of medicine. And then of course, to heal, we want experiences that are caring for people and communities. So think about patient care experiences, like working in a patient care setting, volunteering in a patient care setting, and then community service of any shape, size, form. Like we're a very service-oriented school. We actually require our medical students to complete 100 hours. So you can see by just having that requirement that we find it very important. Anything you want to add to this?
Just, we tell you our mnemonic that the way to remember the 4 parts of our mission, or what we call mission base, is the first letter of each of the 4 parts, the first 4 letters of the word person, and that's who we care for as physicians. And as an individual, we look at you as a person. So P, patient care, E, educator, leader, R, research, and S, service. So PERS, patient care, education, research, and service. Those are our experiences.
So you should know our admissions requirements. We actually in 2020 moved to a competency-based admissions office. So we no longer have specific coursework that we require. We ask the applicants to provide evidence of strong scientific fund of knowledge and strong social interpersonal skills in a variety of ways. Some things that they can do is, of course, coursework is the traditional route to show science competency, but you can show it through research, employment, through military coursework, self-study. We really wanted to allow the students to have flexibility on how they can show that they've met these competencies. Letters of recommendation and the interview can also help demonstrate interpersonal, interpersonal communication competencies. We only require 90 credit hours for an applicant or a student to go to medical school. And then you can see that while we do not require prerequisite coursework, the easiest way to meet those competencies is through coursework in the sciences. So we actually, and I'll let Dr. Neal talk about this too. We recently moved to one letter of recommendation of your choice, or if you're at an academic institution that offers a committee letter, you can most certainly do that in exchange of the one letter of recommendation. Letters of recommendation, we highly encourage you to focus on the applicant's core competencies as listed through the AAMC. And we have on here that additional letters will not increase an applicant's competitiveness. And Dr. Neal, do you want to explain like why?
Yes.
that
So
direction?
we moved to this for a couple of reasons. One is last year we actually had an applicant that couldn't be presented to the committee because they couldn't get their third letter of recommendation in from anyone, and we required 3 of them. So we just think it's a shame that someone's future depended on someone else getting a letter in. The other factor we've seen, and students have told us this, and excuse me, we've heard it from multiple sources, excuse me, that people are often told you can write your own letter and I'll just sign it. So you can imagine how valid can that letter be. Someone can submit multiple letters. We recommend against that though, because the committee is told that they're only supposed to read one letter. So equity is a big issue, and we want the student to be very thoughtful of who they're going to pick for that letter, and want someone who can cover multiple competencies, not just how someone can work in a lab or in their classroom. We want the more humanistic side of that individual.
Yeah, I think, she already touched on this, but just to reiterate that we did want it to be more equitable. We didn't want it to be one of those things where, maybe a non-traditional student who's, maybe doesn't get to attend class in person, or, working full-time, or has been out of school for a long time, would have to find a science professor or, a professor at their school that didn't know them well. And I have, like she said, I have seen a trend in students being asked to write their own letters. So by going to one letter, we just felt like this kind of helps solve that problem.
Yeah. And I just thought of something else, Lauren, that the other thing we see a lot of, that we get letters or recommendations from people who may, someone who may be a very important person or, higher status, and they will send letters thinking that that may increase the student's chances, when in reality, the patient's application, really is going to determine by the committee, not someone's recommendation who may not even know them that well. And we often can tell that they don't know the individual well, because there'll be comments in there about how strong academically they are or something like that. And you can read between the lines that they sound like they don't quite know this person. But anyways, it gets again away from that factor of having undue influence, from someone who may be perceived as being very important, when it may not be the best person that should have written them a letter to vouch for their pre-matriculation competencies.
So these are the core competencies for entering medical students that we are looking for. And this is through the AAMC. It's posted on our website. It's also on the AAMC. You can also take a screenshot of this if you'd like. But I would recommend every upcoming medical school applicant to look through this list and think, how have I been able to demonstrate these competencies? Who are the people in my life that can attest to these competencies that I have? And then kind of base your application around that. So thinking about your interpersonal, intrapersonal thinking and reasoning competencies. These competencies, can be shown through your academics, through your MCAT, right? Science competencies that can also be shown through the MCAT as well, just in your coursework or your research or self-study. So really recommend looking at this list and kind of thinking about, how have I met these competencies? We practice holistic review. This is a balanced consideration of your experiences, which should be mission-based, personal attributes, and metrics. So we already talked about the mission-based experiences, the PERS, remembering the acronym person. Your personal attributes: are you a resident, a pathway student? Do you have ties to West Virginia? Have you shown resilience, confidence through your life in a variety of ways, your inter and intrapersonal competencies, and other things that make you unique, right? Things that you can uniquely bring to a medical school class. And then of course your metrics, which we look at your science GPA heavily. We are a school, I'm very proud of that, we do look seriously at post-bac and graduate courses GPAs. We really value our post-bac and grad students, knowing that it's not easy to go back to school. So we definitely look at those GPAs as well. And then of course we look at MCAT total, and all subsections are important. We always say if all subsections weren't important, they wouldn't have those subsections on the test. So holistic review is a balanced consideration of all three areas. So lastly, we do require the MCAT. We like to say why we do that. It's not because we're mean and we want to cause our pre-medical students more stress than is already on them, but we find that it is a tool to predict an applicant's readiness for medical school. And we totally understand that it's not a perfect predictor, because you can have a bad test day, things happen, but it does have important predictive value for future academic performance, specifically at our school. And I'm going to let Dr. Neal here in a minute talk more about that. Strong performance on the MCAT provides evidence of competency in the sciences. So I already mentioned that's one way to show science competency, thinking and reasoning skills as well. And it can help an applicant if an applicant has a lower BCP and GPA. So I think sometimes the MCAT can be looked at in a very negative way, but I think it's also an opportunity for students, maybe for whatever reason, maybe something was going on in your personal life and your undergraduate GPA wasn't, as great as it could have been, in spite of maybe personal things that were going on. I think the MCAT can actually help show the committee that maybe while in undergrad, your GPA wasn't where it could have been, that you do have competency in the sciences that is proven through the MCAT. Dr. Neal, do you want to talk about the academic or the predictive value?
Yeah, so we look at it every year, and a few years back at a national meeting, we saw that there was a chart that showed what the MCAT predicted for on a national level, like the percent of students, for example, that went on to year 3 of medical school on time. Well, after looking at that and then looking at our own numbers, we found that we came up with a score of 506. And you notice that to apply for early decision, we said have a minimum of 506, because we have found over the last several years that we've looked at this, since we've had this current MCAT scoring system, that those who have an MCAT score of less than 506, and typically only we between 500 and 506, that up to 25% of those students may not go on to year 3 on time, where they either have to repeat a year or not finish school at all, as opposed to half that amount of those who are over 506, or even less than that. So that's where we came up with that 506. We also find that when we follow scores of how students do in the classwork, we do find that those with the highest MCAT scores are usually in the top quartile. The second highest will be the second quartile, and so forth. So it is predictive of how students do in our first 2 years of medical school, the pre-clinical years, I guess I should say. So for us, it is predictive. And so we do accept students with the 500 to 506, but typically there'll be extenuating circumstances of that, just because they are such a high-risk group academically, no matter what their BCPM was or is.
Yeah, thank you, Dr. Neal. And then lastly, how to apply. I think probably at this point, everybody has been to the AAMC.org. If you haven't, definitely go on, look at the competencies. The AMCAS portal definitely has a lot of great resources for applicants who are preparing to take the MCAT, information on how to apply. Basically, I always joke that it asks for everything except for your blood type. Maybe that might be next. But looking through the things that they're asking and start planning that now. I always say time is your best friend when you are preparing to apply to medical school, and the more information you can gather and put in one place and work up leading to the time of applying, the less stressful your life will be when it does come, when the application opens in May of your application cycle. So most specifically, we talked today about the experiences that we're looking for. We talked a little bit about why the MCAT is important at our school. We talked about letters of recommendation and what we looked for. And lastly, I had this on here for one of our other groups, but just a reminder of what are the mission-based experiences we were looking for. Remember the acronym PERSON, that's patient care, education, leadership, research, and service. And if you have those 4 things, you're already a step in the right direction when applying to our medical school. And lastly, why WVU? We have this really nice slide that our Vice Dean of Medical Education likes to use for our medical school student orientation and talking about just the different things that we offer at the school, kind of aside from applying, that we really like to take care of the student as a whole. Here at WVU School of Medicine, we definitely think of how to help them financially through, we have a, what is it, McKinsey? We have a financial expert. Yes.
Oh,
Yeah.
yes,
We have
yeah.
a financial expert. Do you know how often they come? I can't remember.
I don't remember. He's very new. He just started, but we just.
Yeah, we have a financial expert. I
Yeah.
think he comes at least every month, if I'm not mistaken, who is just available for students to ask questions. We also have on-site counselors for students. We actually have an education specialist who meets with all students their first year of medical school and is available to help with study strategies, helping with issues to make sure that the student doesn't fall behind. We offer wellness opportunities, stack exam nights, career counseling. Like I said, we have a lot of student organizations that highlight these areas like Runners Club. We have clubs, interest group clubs, clubs that are really service oriented, religious clubs. So we have a lot of opportunities for students. Anything else you want to add before we allow our students for the
I would say if you're looking for a collaborative environment, we're very, very well known for that. And students and certainly our student services deans are just top notch and, helping each other. And we have a 24-hour dean on call every day of the year for if something were to come up in your personal life. And I think that's quite rare. I haven't heard other schools having that. So the collaboration and really caring about your well-being, because you can't optimally take care of your patients unless you optimally care for yourself. And you have to learn that as a student so that you carry it through your residency and your career.
Yeah, that's a really great point. Somebody's always available. Any questions for us? Covered a lot. You can either enter them in the chat, or maybe we did such a good job we left no questions.
We can give them a second to type it. Oh, Olivia, you have a question?
Yeah. Oh, sorry. Can you hear me okay?
Yes.
So way back when you were talking about residencies and different programs and such that, I'm not from West Virginia, but that's neither here nor there. I'm from somewhere else rural. And I'm definitely interested in rural medicine. I saw what you were talking about, that rural track where you get the, hang on, I took notes. Anyway, the rural track where you get the fast tracked into residency and a guaranteed thing. Is that specifically for rural family practice?
So we have a rural track, which is something that starts even before you go to med school. And that's not a fast track. And you can go into any, if you go on the rural track, you can go into any specialty you want anywhere in the country or whatever. Then we have a rural scholars program, and that's the one where you apply during your 3rd year. And we have one in family medicine, internal medicine, and in pediatrics. And that comes with a $10,000 stipend off of year 4, and you're guaranteed a position in one of those 3 specialties. But if you do the rural track, we've had students matching all kinds of specialties from that, and it doesn't matter what specialty you go in for that, if you do the track. So it's a track versus a program. A track, actually, you have a little bit of a tweak in your curriculum. The other one, the program, is the 4th-year rotation with the directors establishing a project, and you do a 4th year of med school. So that's the $10,000 stipend off of your 4th year of medical school. Did that clarify it for you?
Yeah. Oh, I was just a little confused about what the overlap of that was. You mentioned also that for the rural med track, there's stuff that happens before MS1?
Yes.
What is that?
Yes. So you apply after you have been accepted to medical school. The directors of the rural track will go ahead and will have you apply if you want to be in the rural track. And then if you're accepted to the rural track, you come. So we begin medical school it's usually the end of July is when 1st year of medical school begins. But earlier in July, you meet as a whole group, all the rural track students with the directors, and you have like an immersion type experience with all your co-track people. So you sort of form like almost a little group already. Although you may be at all different campuses during year 3 and 4, you're all in that same track, and you'll do other group work together with a little bit of a rural twist on it, if that makes sense. Usually
Okay.
those are the tracks. They form their, they have their little groups. But as I said, some are in more than one track. So yeah, I think it's a bonding experience before medical
Yeah.
school.
I
So
would like to point out that regardless if you're the track or the rural scholars program, you do have like mandatory rural
yes, yes.
rotations as well. So you get that regardless if you're in one or the other. But I guess the point is there's a lot of opportunity to have some rural health experience before you
Right.
graduate.
And I do have to say, most people probably don't do rural medicine after they do all of that, or we wouldn't have such a shortage in West Virginia. I sort of wish they would follow through. So it doesn't
Yeah.
commit someone to, because it may have the opposite effect. You may be like, oh, maybe this isn't for me, right? But then, as I said, you're going to pick up skills that you're going to use anywhere in any field. So. But Olivia, you said you're from someplace rural. Where do you want to share where?
Sure. Like more or less. I grew up in northern Utah.
Oh, okay.
My family, it's not like a business farm, but we have a small farm. We live greenbelt.
Okay.
We
Okay.
back up on the mountain
Farm.
range.
Gotcha. Okay.
Yeah. And there are professional farmers on one side of my family, and a lot of passion for it. So
Okay. Well, we have farmers on the admissions committee. Dr.
cool.
Rhodes with his goats, right? Yes. Our pediatric cardiologist.
Mackenzie
Yeah.
has a small
Oh,
farm. too.
Mackenzie, when I have meetings with Mackenzie, there's like a turkey looking in the window when she's talking to
Perfect. One of my dream
What
goals, I'm telling my friends right now, I'm in Baltimore, which has been a great city experience, and it's fun having that. And wherever I go next, I want to have a backyard so that I can have a garden and chickens.
Okay, well, Mackenzie has that too, yes.
Yep.
Yes, I
That's
wish you could
great.
have a turkey. It's very
Yeah.
nice of you.
Yeah. Well, that's great, Olivia. Thanks so
Anyway,
much.
thanks for answering those
Yeah,
questions.
absolutely.
Sure. Stay in touch. We have a good number of students from Utah in WVU School of Medicine
Yeah.
too. Yes,
We really do. We always have at least
have them in every class.
Yep.
Yeah. They fare well. I think word gets around in Utah. Anyone else?
I was gonna say, anyone else? I didn't see any private chat. Sometimes I get any. Did you all
Sure,
get any
yeah.
private
Mm-mm.
message? Okay.
I don't see anything.
Well,
Well,
we
certainly if anyone reaches out to you guys, share our email addresses and,
Yes.
because staying in touch with us, we have a question on our secondary application that says, do you have ties to the state? And even if it's something like this, where you showed interest and
Mhm.
certainly like Olivia asking questions, you put in there, if you have no other tie, you could put yes and say you came to our presentation. And seriously, it means that, you showed a level of interest. So makes a difference. I mean, can't guarantee anything, but doesn't hurt.
Yeah, asterisk. I know,
Yeah.
but yes, we do actually appreciate it because it also helps us to identify students that, you know,
Yeah.
that we've interacted with.
Yes, so we can
Thank you all
recall.
so much. We really appreciate the time. Thank you, Zuri. We appreciate you.
Yes, thank you for inviting us.
For
Yes.
sure. Thank you for being willing to host. So it was very much helpful. And so we'll definitely provide this to the students who couldn't attend, and we will
Sure.
share that. So, and also the contact information is.
Okay, wonderful. We'll stay in touch with us too. Very nice meeting all of you. You
Thank
take
you. Have a
care.
great
Good luck,
evening.
Olivia.
Thank you.
Bye-bye. Good luck, everyone.